This brief instructional video has been created to familiarize you with the proper at-home care for your dog recovering from tibial plateau leveling osteotomy or tibial tuberosity advancement surgery. All of the instructions discussed in this video will be provided to you in written form to take home, so there is no need to write anything down. Before your pet is discharged to you today, you'll be given an opportunity to ask any questions to a surgical technician before your dog is discharged. Please pay close attention as we'll now begin discussion of your dog's discharge instructions. Most of your dog's care entails management of activity. Your dog does not understand the nature of his or her surgery and will want to become active in a short period of time. Therefore, restriction of activity is of paramount importance. This generally means confinement to a cage, crate, or small room. A cage or crate should be big enough for your dog to be able to stand in and turn around. No jumping, no running, no stairs, no playing with other dogs, and no roughhousing. When taken outdoors to urinate or defecate, your dog must be on a short leash. This degree of confinement is important and must be continued for the entire recovery period, except when performing the specific activities described hereafter. Excessive activity may result in re-injury and/or complications requiring additional surgery to correct. Begin passive range of motion the first day home. Passive range of motion helps to enhance joint flexibility and decrease stiffness. It also improves blood flow to the affected leg and joints. The ankle or hock is gently flexed and extended. Followed by the knee, and lastly by gently extending and flexing the hip joint. This is performed for 10 to 15 repetitions 3 times per day. Never force the leg. Stop if your dog appears painful. Multiple 5-10 minute walks are allowed on a short leash 3 times per day. Confinement is maintained when your pet is not undergoing these activities. Ice your dog's leg after passive range of motion and walks. Do this ideally for 15 minutes 3 times per day. Ice can be in the form of ice cubes in a bag, bags of frozen vegetables, or commercial ice packs. Some patients may be sent home with a sling. To help your dog, first place a sling under your dog's belly. Gently assist your dog while rising and walking. Only gentle support is needed, and shift the sling as necessary for male dogs so they can urinate. Continue with passive range of motion through week 2. You may discontinue the icing of your dog's leg. Increase the duration of short walks on a short leash to 10 to 20 minutes 3 times per day. Flat surfaces only. Avoid hills or difficult terrain. If you notice increased fatigue, soreness, or discomfort in your dog, revert to the previous level of activity and begin again from there. Staples should be removed at 10 to 14 days post-operatively by your veterinarian or by MedVet. Please make an appointment. Increase the duration of leash walks to 20 to 30 minutes 3 times per day. Still only walk on flat surfaces, avoiding hills or difficult terrain. As before, if you notice increased fatigue, soreness, or discomfort in your dog, revert to the previous level of activity and begin again from there. You may now add sit to stand exercises to your dog's recovery exercises. Please have your dog sit, then stand, and repeat this for 10 repetitions 3 times per day. Reevaluation at MedVet is required at week 6. Reevaluation is very important to your dog's recovery and should not be missed. At this time, x-rays will be taken to confirm adequate bone healing of the TPLO or TTA surgery site. Changes in post-operative care will be discussed at this time. Monitor your dog's incisions throughout the recovery period. Please watch the incisions daily for excessive redness, swelling, or discharge. A small amount of thin, blood-tinged fluid is normal. The incisions should generally look better every day. If you are concerned with the appearance of the incisions, please call MedVet. Physical rehabilitation enhances recovery from TPLO surgery. The special equipment and trained personnel available at Veterinary Rehabilitation of Ohio here at MedVet can assist you with your dog's recovery. Please read thoroughly the written discharge instructions you are given, as some key points are not covered in this video. Keep in mind your dog's well-being during this recovery in order to minimize any complications. Please do not hesitate to contact MedVet with any questions or problems. Thank you for your attention. Please inform the receptionist that you have completed watching this video so we can release your dog back into your care.